My name's Farida Khawaja. I'm an emergency medicine specialist trained in Australia. I'm based in Tasmania, Launceston, Tasmania. I hail from Pakistan, Sialkot, Pakistan, where my father also comes from Kashmir. My mother, she's German. And I grew up there till I was 18 and then left and have been really a globetrotter until I arrived in Australia, and I've been here for 20 years now. But my relationship with Pakistan has become a lot more poignant because I've been able to take the skills I've learned here as an emergency medicine specialist back home, and I go back typically 2 to 3 times a year and work there in various capacities. With regards to my connection in Pakistan and how it's influenced me, I was very, very fortunate again that when I first finished my internship, the hospital I worked for, they would allow me to go for 3 months at a time as a junior doctor back home. And again, the connections I had through my mother and through family and through my hometown, I would be able to assist with and follow and learn from experts in the field. You know, in Australia, where you see one patient at a time, to in Pakistan being in one room, tiny room, with 3 tables, 3 chairs for the doctors and 3 chairs for the patients, and we would be seeing patients simultaneously. I could see 60 patients in half a morning. And that is extraordinary experience, but it also brought a level of concern because we were missing a lot of things, or it helped me to see what were the systems that would make it so challenging for patients to arrive. I can understand, how you can develop an apathy. You can develop a protective mechanism to save yourself from the sheer demand that exists for care in our country, because people don't have access. They don't have access to care that they trust. And there's a lot of mistrust that happens. And there is a lot of abuse of power in the medical system that occurs as well. So I, it's an honor, but it's also an overwhelm. And working with the Pakistan Society for Emergency Medicine, you have a cohort, you have a team of people who really care for national-wide solutions, who want to integrate it into how do we make it all possible for everyone. That is really encouraging, and that took me many years to develop that relationship. And I've seen people who are extraordinary, who don't have my connection that I have with Pakistan, who deal with, deep, deep respect and curiosity and learning. And I've seen Pakistanis who come back home pretending they know all the answers, and coming with quite a large, ego and sense of worth, because we put so much worth on the outside world or onto the UK answers or the American answers or the Australian answers. And I guess I have that advantage of language, obviously relationship, being able to help people navigate culturally, what may be acceptable norm or not acceptable norm. So things like that. But I might also be blind to things that somebody from an outside view is not as blind to or has experience elsewhere and is able to be curious about, because it's normal for me. So that helps me to see. So that's why I do like inviting people from various backgrounds to come, and to come with a heart or an intention that is receptive or open or curious. So, and also to remind myself to come like that, because I'm spoiled in Australia, by and large. I have great access. I have great teams. We have medication. I don't have to pay for anything. It's a public health system, and I love working in that. But when I come to Pakistan, I have to navigate that lack of, and navigate very different hierarchies that somebody who comes from outside and doesn't know would really struggle with. They would not be able to infiltrate within as much. Yeah. The one piece of advice I would give to somebody who has a connection to a low resource setting and is, don't forget and harness and relate closely to that connection. Let it inform who you are. And when you go back to work there, ensure you're working with local initiatives that are occurring and being a person who helps people to reach their own full capacity. And always have a mentor, have somebody to speak to and share with and reflect with, because we learn so much about ourselves, and about our strengths, and also about our blind spots. So I know in my hospital, at times we invite people to share of it at grand rounds, what people are doing. Other times people have done fundraisers, and through those fundraisers, they will invite people into learning more about what's happening. I've done a fundraiser to help start the emergency life support program with the mannequins that we bought, and I wanted to get top quality things to set standards and to say, there were several layers of reasons behind it. But I did a fundraiser together with the community gardens in Alice Springs, and half of the money actually went to a community project in Alice Springs. And the community came. They were amazing. They brought food, they brought music. Children painted messages for local care and global care. So it was just people donated lots of things to sell, and somebody actually made even an arts installation, a musical arts installation for children to be meandering through and playing through in the community garden. So that shared collective, both local response and global response, was one of the most powerful experiences I've had. That hopefully the global experience and my really intimate relationship with people in Pakistan and my family and the community that I've been working with in several communities, that I can continue to go back and offer those learnings that are there, and remain receptive to feedback, and remain receptive to people's experience, and be open, because none of us, and I don't have any, all the answers. So yeah.
Hi, everyone. My name's Taj Hassan. I'm based up in Leeds. I think I know some of the names on the list. Nice to have the opportunity to talk to you. And Farida, of course, I know very well, because she and I, luckily, our paths crossed a number of years ago. Which I'll sort of talk about. So thank you to Gecko and Anissa and the team for giving me a bit of a chance to share this platform to talk about my perspective, and I suppose my journey. Frida's given a fantastic, sort of much more reflective view of what she has achieved over the years. I'm going to sort of, I think we're all a bit different, you know, where which part of the elephant we grab in terms of our perception, our vision, and what we want to get out of perhaps giving to the country of our birth. So my background, I was born in Pakistan a long time ago and came to the UK when I was 6, but continued to go back to Pakistan every 2 or 3 years. So luckily, retained a fair bit of my culture and language. I was born in a small village in Punjab, very far removed from the joys of the UK. And I think when I qualified as a doctor, you know, I had a little bit of a feeling, well, perhaps I should, you know, give something back to the country of my birth. But actually, that grew out of all proportion as the years went by. And initially, I would go back to the village because my mother lived there, and the line of people who would want to come and see Dr. Saab was great, you know, and I felt very proud of myself. But actually, as I went on and then began to be offered chances to give lectures, I realized actually it was just, you know, I was a tiny pebble in a massive ocean in a country which is way, way beyond anybody's perceptions of the needs for an emergency care system. So I think my sort of talk today is, you know, a little bit about the what and what you can achieve, but the why and my journey of why I felt why I felt the need to contribute back to Pakistan as I have, and as that has sort of magnified, and how we've done that to date, and some of the links and the lessons that I've learned. So the why is sort of, I suppose we've hinted at. My own feeling is that I've always had this constant guilt complex. Never mind my family, but you know, always wanting to help my family because there is quite a lot of family in Pakistan still. But the guilt complex of the country that I've grown up in here in the UK, with just a tremendous amount of resource, you know, so eloquently described by Farida as well for say Tasmania, and yet the realization that probably 1,000th of percent of that resource being spent wisely in Pakistan could have such a magnificent effect. And so there's a tremendous opportunity there to do good and feel better. And of course, in Pakistan, there's the complexity of work is phenomenal because, of course, public health systems are archaic, if non-existent, huge amounts of trauma, huge amounts of medical pathology, terrible childhood illness and injury, incredible resource. So the need is massive. And the variability of practice, of course, is again magnified. You can get first world care, but most people, and I would say that's at least 80 to 85% of people, struggle badly with the most basic levels of emergency care. So it's that conglomeration of why one wants to help. And the journey for me in terms of what I did for a number of years, I had some good contacts. Some of my family were quite senior in the military, very senior in the military. And so, you know, me bounding along and saying, I really want to help. And so they would connect me to somebody important, and I'd get to do a lecture in a hospital. But that really didn't help matters. And unlike Farida, I didn't have the capacity to go back for a prolonged period of time for a whole variety of reasons. And so I've been trying really to build something from frequent visits and from connections. And what we've managed to do, so Farida will remember this, she's in some of those photographs, and she and I first met absolutely by chance in Islamabad at a hospital called Shifa. And we really struck it off, and we were coming at the same problem from different angles, um, with a small group of people, and that was the key. You have to find the people in Pakistan or in your whatever country you're intending to work in, who are like-minded, who you can connect to, and who you can offer your services for them to advance and gain. It has to be absolutely done on their terms and not yours. And I think that's something that I was lucky enough, I suppose, to learn perhaps in the early years from some painful experience. But as time went on, I realized that actually connecting to all of those people that you see in those pictures and just offering my services to them has produced some really good outputs. The developments of emergency medicine in Pakistan, there are some doyens, who tried to really get it going. A guy called Junaid Razak, who's a good friend in Karachi and is now in the States. But about 5 or 6 years ago, it was resurrected by some of those people in that picture. Abdul Salam Khan was the president of the Pakistan Society of Emergency Medicine, and another guy called Junaid Mustafa. And I think we, Farida, myself, others, have created this network which allows that core group in Pakistan to lead and for us to be the sort of group in the background providing guidance, nudging, expertise if and when required. And that's been quite a really powerful formula. It's allowed us to set up the Pakistan Society for Emergency Medicine back in 2017, to run a leadership summit in 2019, where we had some aspects of government, and we built a roadmap for emergency care in Pakistan with a number of key players. And then, of course, COVID came along, and then 2 years later, we ran a virtual conference earlier this year, which actually started from small beginnings, but had 3 days, 110 lecturers, 5 continents, and it was great fun, and it produced energy, and it creates momentum. And I think that's the key thing, is finding ways, once you connected with your team, to create momentum. I'm not going to speak about the details of this, but this is, again, probably still very aspirational. These are the things that the Pakistan Society is intending to do and wanting to do. And we internationally, Farida has faculty, I sort of chair the international group, and Farida is the Australian lead. I have colleagues, Ayaz Abbasi here in the UK, helping me in the UK, people in the Middle East, people in the States, people in Canada. And what we've done is we've really built an international network that supports the core leaders in Pakistan, because it's very easy to estrange people if you in any way are deemed to be, and there are quite complex sort of hierarchical structures that you need to understand. The core group are very level-headed, but the people around them not necessarily so. So I think whatever vision you build within that group, and we think we've built something really quite good, but it does generate this sort of capacity of moving 2 steps forward and then 3 steps back, and then 3 steps forward and 2 steps back, and but the momentum has been forward moving, and that's a good thing. And I think one of the things that I've really aspired to try and help colleagues in Pakistan to do, and also my colleagues on the international committee, is to constantly for us to jointly look up and create what we think is this shared vision. And we sometimes go through quiet periods, but then it moves forward again. And I think looking up and creating something and understanding the complexities of Pakistan is really, really important, whatever country you're in. So if I give you 4 pillars that we've tried to influence, we've obviously built this network of the Pakistan society and really tried to support them in different ways. The CPSP is a group is a body, is the single academic body of medicine in Pakistan. So we have 20 Royal Colleges in the UK. Pakistan has a single academic body, the College of Physicians and Surgeons of Pakistan. And so it's really important to keep them on side, and that's quite a difficult diplomatic task, and one that I've taken on with friends and colleagues in Pakistan and internationally to try and really influence them positively. They also have another regulatory body called the Pakistan Medical Council, and that's what we've been connecting to them. And then finally, they have the federal and provincial government. So we're trying to influence all of these in order to create this vision, and in order at the same time to, at the grassroots, do the basics really well. Because actually creating a structure that gets to do the basics really well is really important. And I've learned a lot really about, obviously my past experiences of working at the Royal College emergency medicine. I learned so much there, and in a way I've tried to transpose the skills I learned there into this, and it's an incredible challenge. It occupies a lot of mental energy, but when you go to Pakistan and then you connect, it becomes incredibly energizing, and people are so grateful for the tiny amount of seeming effort that you think you're putting in. They're hugely grateful, which I think is quite humbling. I love this thing by Mandela, and I've been always a real strong advocate in recent years around this, that you have to combine your vision and then do something. I think in my early years as a consultant, certainly as a trainee, I ran around like a headless chicken, thinking I was doing some good, and I probably, on reflection, didn't do that much. But I think as time has gone on, I feel like I'm contributing in some small way, which is good. So that's what I've spoken about. I'm sure we could all go on talking, but I've probably exceeded my time, so I'm sorry about that. But thank you for the opportunity. Cheers.
The plan was to have a panel discussion, but I think given the number of us in the room, I don't know whether it might be, I don't know what you guys think, whether we should just continue the conversation in a wider group, considering everyone can fit onto my screen. Is that right? There are only the 16 of us. Is that right? So I think that we should probably carry on our conversation. And obviously we've got Taj, we've got Farida, and we have also Ben. I'm going to introduce you guys to. In fact, I'm going to allow Ben to introduce himself to you guys, because he was going to be part of the panel. But as I say, with the dynamic of this, it might work quite nicely if we, really just carry on the conversation. So Ben, can you just tell everyone who you are?
Hello, everyone. My name is Ben. Conveniently, my surname is Human, but I'm actually a bit of a cultural chameleon, so I feel very welcome in this room, because I know that that's how everyone else is here. I was born in South Africa, but the majority of my childhood was spent in France. And then I came to Leeds for university, where I did medicine and a degree in international health. And then following that, I went to go work with Anissa and Pete in Manchester. Did a clinical fellowship there in emergency medicine and ultrasonography. This year, I'm doing a bit of public health. And then next year, I'm hopefully rejoining Leeds in the ACF or ACCS program. And I thought I'd just maybe kick off with a few thoughts, because we were assigned this homework for tonight. And one of the things that fascinates me now is this chasm between the global north and the global south that we often read about. And if I may, I will quickly can I share my screen, or is it recording? Should be able to.
You should be able to.
Let me have a look. There you go. All right, well, it's not working. Essentially, if you go on, there's a resource called World Mapper, and I'd really recommend that you have a look. Just Google World Mapper, and it blows up the map according to where resources are or where anaesthetists in the world are. And essentially, if you look at the map of the global north, the gross national income, the north plus Australia is completely inflated. But then when you look at something like health outcomes or deaths due to COVID, you've got the south, which is completely inflated. And we see that throughout, trends in global health. And that's the kind of chasm that I'm trying to bridge in my work. And I think, I don't know if anyone watched the Earthshot Prize on Sunday with Prince William and Kate, but they talked a little bit about circular economies, which is obviously in the realm of climate change and waste. But I think actually we work in an economy of emergency care skills and expertise. And traditionally we've worked on a very linear kind of model where we go from the global north to the global south and we try to input our ideas. But actually what I really am trying to work towards for us as a group, and I'd be interested to know what you guys think, because I think it's a very difficult thing to do, is how to make that into a circular economy where it's sustainable, and actually you don't need a representative from the north, the global north, to come to that global south to make the change. And actually you can empower them to do that themselves, so that when you leave, there is a system in place. So very much what our keynote speakers were talking about. That is what really interests me.
Thanks, Ben. That was great. There was one question that came up. Obviously, we've been discussing that it's a really broad topic once we start to kind of step out. I'm just thinking about this personal connection thing and how that functions. I don't know what came out from the other group. Were there any sort of key points that Pete, perhaps you want to share from the group when you were discussing?
It's really interesting, actually. Everyone's got a broad range of experience. I think there
are downright apocalyptic images coming out of Australia right now.
Sorry, Pete.
It's all right. I think the thing that kind of Jasmine brought up was about, and I think Taj had mentioned as well, was about like duty and feeling like obligation to go back. I think I spoke to one of my friends who's from Syria, who's studying to be a surgeon, and she mentioned the same thing, like the duty to want to go back, but also the duty when she's here to try and represent Syrians as well. So the idea that sometimes people have a certain perspective of what a Syrian should be, and she used the word like a refugee, and so she saw it as a duty to work here for Syrians, but also then to take their skills back home, which I thought was quite interesting and kind of tied into a bit what everyone's been saying.
One of the things that came out from our group in different ways, and in fact it was Tony that prompted this, and it sort of triggered a little bit of a thought process, that this idea of playing to strengths and the idea of somebody being from a place and wanting to do some work, and how do we not play better to those strengths? How does that, how do we make that better? Should we make it better? Can we make it better? And then it got me to thinking about this idea, which is, perhaps a controversial concept, but not really. The idea of somebody, is from a certain low resource setting, and yet they choose to then engage in their global health work, but somewhere completely different to their country of connection for lots of reasons. But are there more reasons to that than we actually realise? And is it just complete wish to disconnect, or is there something more about the burden that comes with connecting back to where you're from? Because that lets a lot of things in that you may not be ready to deal with. Because again, I've shared a bit from my own perspective that once I reached beyond the stage that actually Siv was talking about, was that weird cultural assimilation thing that you go through when you are, second generation or mixed race, whichever way you want to look at it. If you reach a point where you feel like you want to connect back with that place, you know, there's this guilt, and then there's also an awareness of the privilege that you have afforded by happening to be present in the UK, as compared to, in my case, would be where my father's from, which is Pakistan. And how you sort of navigate that is perhaps less clean than somebody who doesn't have that personal connection and all of that strange burden that comes with it. Whether that makes it more positive, more negative, it certainly makes it different. How different, I don't know. And I guess everyone has different awarenesses of that. But what Imad was going to say, is he still here? Oh, yes. I don't know how I can't see everybody on my screen, because you're right in front of me. Was what happens then when it's not just two countries we're talking about. What happens then when it starts to become three or more? So Imad, I'd like you to just, if you could, just expand a bit on the comment you're going to make about that. And I guess anybody else who wants to jump.
No, absolutely. But I think Ben is a perfect, he would be the perfect example of what I was about to say. With his connections to multiple countries, South Africa, France, the UK, and wherever he takes his journey forward. And mine's a bit similar. I'm born in Pakistan. That's where I have my connections with initially. But my parents moved to Saudi Arabia when I was 10 months old. And I came to the UK from Saudi Arabia. I did always maintain a strong connection to Pakistan because we spent every summer holiday in Pakistan, and that's where I went to study medicine as well. And I've been in the UK for almost 7 years now as well. So I've got strong connection to all three countries. And sometimes when realizing that Saudi Arabia is by no way a low or middle income country, but they also have as much of a pull on me to want to give back to them in emergency medicine and in anything else that I do as well. So when I was there, we'd work with this doctors group and do welfare clinics in the Pakistani embassy in Saudi Arabia. But now that I'm here and I'm still doing work with Pakistan, I sometimes wonder, what can I do that will benefit Saudi as well? And an interesting thing that crept up when you were talking, Anita, about maybe not having those negative connections as well, was because I only went to Pakistan during summer break. I didn't have to go to school. It was all fun and games. I guess I've got a very utopian relationship with Pakistan, and the Pakistan that I know and the Pakistan that I love and the Pakistan that I grew up with is probably not the Pakistan that my relatives live in. And maybe I'm a little bit more eager to serve back home than some of my colleagues or friends or relatives are still living there.
Can I just say, I think it's along all these lines of we are playing to strengths and we're playing to, the elephant, all the different approaches that we have. And those approaches all change as you adapt to life. There by the grace of God go I, in terms of what are the causes and conditions that have shaped me. And those causes and conditions are very much that are shaped by our parents as well. Like Siva has shared about her parents moving when she was 3 to Sri Lanka. What are the fears that they held for her? And in their love for her, trying to protect her, help her, they have instituted certain perceptions of the new community to, help her to survive. In Pakistan, my mother's German. My father's Pakistani. When I was in the village, I sat on the floor, I ate with my hands, I licked my fingers, I did everything that was done in the village. When I'm at home, my mother's like, sit up straight. Her grandfather and her father used to put a stick in between their elbows, and you'd have to eat properly with knife and fork and be really sitting. And she wasn't as strict as that, but I had to know, because she said, you're going to Germany, you need to know how to eat, because I don't want to be embarrassed in front of my family when you eat with your fingers. It's just not done. So I guess the thing about it was, I don't see it as any longer the advantage is, I don't see it as being right or wrong, good or bad. Yeah. Or it's just, how do I skill my child, or how do I skill my child to have the ground or the basis to actually, from an ethical point of view, remain embracing, as what Siva's work is doing, to all sorts of different variety, and be able to adjust into that. And how do I help you to feel safe? And, you know, there were times I was utterly unsafe as a young person going through school, for example, because I went to initially a school that was extremely poor, and then subsequently got a scholarship to a really rich school. And people changed their clothes every day. People from Pakistan would go for their week-long holiday to the UK and do their entire shopping there. And I had 2 pairs of shoes, you know. And so I was this poor kid in this very rich school. And so that's not a cultural, it's not cultural from, you know, your heritage point of view, but it was cultural in terms of money and in terms of access. But my value, or what grounded us, you know, didn't change, you know, was what my mother really was. She was with you. And so then that helps you to navigate, you don't, you know, future challenges, and to engage with when it's hard, when it's uncomfortable. And, you know, it's true, you know, I've had challenging experiences in Pakistan, you know, also gender is a big issue. I mean, I've had an anesthetist, when I've been helping him, you know, quiz me for 8 hours, 8 hours. I was just like, I've had it. And many times people actually be wrong and not acknowledge as well. And oh, you're just a woman, just you only know how to deal with the vagina. You focus there. And I was like, oh, I know. So, you know, anyhow, so there's a lot of layers of how we create judgment around, well, who's capable or who's not, or what they should know, or what's right or what's wrong. And I guess those are some of the things we need to be inquisitive and explore and say, okay, what is biasing my way of thinking or looking at it? And how do I help somebody to feel safe and grounded so you can actually explore? How do I do that for my family or for my children as well? And whoever I encounter, you know, I have people coming from Pakistan to visit here, and they'll find it very challenging, certain things, you know. I don't have locks on my bathroom doors in Pakistan. That would be terrible. You know, I have to have a lock on my bathroom door in Australia if I have a Pakistani visitor. So all these sorts of things, what stresses people out is really interesting, because of what makes us feel safe. And then how do we explore? And so, yeah, just a few thoughts about that.
I don't want to come in on that, because so there was one bit that particularly that Gabby and I had discussed, actually, I think it was yesterday, so when we were prepping for this, was the sort of, wherever you kind of end up on this circle of discussion around, you know, back home, not back home, from here, you know, a parent from here, a grandparent from there, whatever. When it all actually boils down, and this kind of brings in a lot of, probably brings in a lot of the work that Siv does. So Siv was talking to us about the Embrace campaign that they've started at the Manchester Royal Infirmary, which is really all about sort of spotlighting ethnic minorities and trying to bring them into the conversation, make people, you know, I guess improve our cultural awareness, so that we actually start to interact on more of a level and appreciate people's heritage. But I think beyond that, a lot of the divide is this rich poor concept, this, you know, have and haven't, and the way that we place ourselves, you know, even as we move through all of these different places, and as a person, the kind of you have not almost makes the biggest difference to how all of these things tend to play themselves out, and how you place yourselves in that circumstance. And often when it's all broken down, as Farida was sort of alluding to in her own experience, that these kind of differences, I mean, we consider them to be so different. Myself being in Pakistan, well, we just have to look at Pakistan as a country, just as we look at the UK as a country and South Africa as a country. The differences between different social groups and the tensions and the difficulties are way more palpable, dangerous, I guess, impactful than any of the differences that we could, I guess, envisage or imagine on our own part when we place ourselves in relation to another place. I don't know whether anybody has any thoughts about that.
I wonder if I could just add to that, Anissa. It's been fascinating listening to everyone, and I think that it just sort of resonates with all sorts of memories of my childhood and upbringing when I went to Pakistan and when I was here. And I suppose just, I know time is short, cutting to the chase, the two reflections I have of, part of you putting this fantastic sort of evening together was, that, we want to help possibly our country of birth in some way. How do we do it? And I think that journey of, so in the early days when I went, and would meet and got to meet some VIPs and had given a lecture or whatever, and then they would say to me, but what do you want? What do you want, Dr. Saab? You must want something. You can't be doing this for nothing. And I think that's really difficult culturally, because you are doing it for nothing, but actually they think that you actually have some monetary gain, because that's unfortunately part of the culture, because it's so tough. And then see it differently, those doctors who come over here from Pakistan or India, or elsewhere, that over the years I've been a mentor to, I was mentioning in the last group, I've learned so much about how they manage power axes and learn from that experience of, caring for them, sharing their experiences, trying to get them to be as level-headed and level-minded, and learning from their experiences. And I think my last point really is those two experiences, whether you go out somewhere or whether you're bringing, doctors, you're engaging with clinicians over here, is you decide on navigating your own journey of how you're going to contribute. You might contribute in connecting with just one institution, with one contact, and that will be energizing for you. You may find that you've actually connected with a bigger organization, NGO or whatever. And I think trying to do it in a safe, consistent manner, which with something that's not going to exhaust you, is really important, because you'll no doubt have part of your other life as well. So those are just three reflections. I'm sorry if it didn't completely intersect with what you were saying, but I just wanted to share that.
No, that was really helpful. Thank you, Taj. And I think there's a lot of all of this that it brings up more questions, I guess, than it does answers as such. Nobody's trying to answer anything in this conversation, and that was never the purpose. I kind of hope really what we've managed to do is just to I guess, stoke some fires and some conversations that might carry on beyond this event. And might carry on with colleagues, and certainly for those of you in the group who, because I know we had a little bit of this this conversation, and Gabby won't mind me saying that I think when it came to this event, I think one of your comments was, this is not my area of expertise. I haven't quite got, purely from being, and we'll be blunt about it, just purely because of heritage. But actually, there are so many ways to engage in this conversation, regardless of heritage. And I hope that's something that we've managed to do, at least to spark it going forward. I'm aware of the time, because we like to be as timely as possible with Gecko, because we feel like it's important. But is there anybody who wanted to add just kind of any final thoughts or final comments? I know there's a couple of things that have kind of come up in the chat. Just a mention of, so Siv has put in there about Thursday being World Values Day. Asking the question there, what are your core values and how have they impacted on our contribution here? The link that she's put up there. And then Imad, what you've said is sometimes it's easy to make up a benefit you're getting from your work. And I think that's quite an interesting thing about how we justify our own actions, our own existence. And yeah, I think that's quite interesting. Anything that anybody wanted to come back with?
I guess it's less about justifying yourself, but more about making yourself relatable or understandable to the people you're trying to help. And if their core values do not coincide with yours, you need to help them find a reason why they can trust you, and they can't trust somebody who's not gaining anything out of helping people.
I love that. I think that's I think one of the things I often say to people is I always want to kind of know what is the reason a person in front of me gets out of bed in the morning. And if I don't know why they get out of bed in the morning, then I don't understand the person. And I think that's really, as far as authenticity is concerned, people understanding you and your motivation and why you are there, whatever that motivation is massively important. And I think I misunderstood you actually, Emad. I'm so glad you clarified that. We've got Taj's recommendation to read Daniel Pink on Purpose in Life, which is probably a nice way to bring this all to a close.